Hey everyone, imagine you're a doctor and you have to make a split-second decision that could save lives, but at a terrible cost. Today we're diving into the trolley problem, but with a hospital twist. Buckle up, because this might just change how you think about medical ethics. The trolley problem is a famous thought experiment in ethics. Usually, it involves a runaway trolley and the choice to divert it, saving multiple lives but sacrificing one. But what happens when we bring this dilemma into a hospital setting? As someone who's spent time wondering about loved ones on life support, I can tell you, these questions aren't just theoretical. They're deeply personal and profoundly difficult. Let's set the scene. You're a doctor in a busy hospital. You have 5 patients, each in critical condition and in need of organ transplants. Then a healthy patient comes in for a routine checkup. You realize this person's organs could save all 5 of the critical patients. What do? The utilitarian approach would say to sacrifice the one to save the 5. But as healthcare professionals, we take an oath to do no harm. How do we reconcile these conflicting principles? It's not just about numbers, it's about the value we place on each individual life. I've stood by hospital beds, watching loved ones breathe with the help of machines, wondering, is keeping them on life support the right thing to do? What if their organs could save multiple lives? These aren't easy questions, and there are no easy answers. But here's where it gets even trickier. What if the 5 patients have different chances of survival? What if one is a child and another is elderly? Does age factor into our decision? Or what about social status or criminal history? Should these things matter when we're deciding who to save? I want you to take a moment and really think about this. If you were that doctor, how would you decide? What factors would you consider most important? Pause the video if you need more time to reflect. These dilemmas aren't just thought experiments. Healthcare professionals face versions of these choices every day. They have to decide who gets the limited ICU beds, who gets priority for organ transplants, or when to switch from life-saving measures to palliative care. And it's not just about the immediate decision. These choices have ripple effects. Saving one life might mean losing another. The emotional toll on doctors, nurses, and families is immense. It's a weight that doesn't easily lift. So, how do hospitals handle these situations in real life? Most have ethics committees that help guide these difficult decisions. They consider factors like urgency, likelihood of success, and sometimes, yes, the number of lives that could be impacted. But even with guidelines, each case is unique and heart-wrenching. As we wrap up, I want to emphasize that there's no one right answer to the trolley problem in hospitals or elsewhere. It's a tool for us to examine our values, our ethics, and the impossible choices we sometimes face. What matters is that we keep having these conversations and striving to do what's best, even when best is hard to define. I'd love to hear your thoughts on this. Have you ever faced a difficult medical decision? How did you handle it? Drop a comment below and let's discuss. Thanks for watching. Till next time.